and welcome to Tata Sky Family Health. This year, World Heart Day's mission is to use the power of digital health to improve awareness, prevention, and management of CVD globally and to continue to use heart to beat CVD. Use Heart to Connect is about using your knowledge, compassion, and influence to make sure you and your loved ones and the communities you're a part of have the best chance to live heart healthy lives. Today, to talk about all of this and how to manage it and make people more aware in the light of the recent pandemic, we have with us super specialist Dr. Ajit Mullasari. Dr. Mullasari is the Director of Cardiology at the Institute of Cardiovascular Disease, Madras Medical Mission, Chennai. He was the recipient of the Glaxo Medical Education Award for the highest marks in medicine at the third year of MBBS examination. He was also selected as the Rotary Foundation International Ambassador Scholar for 1993-94. He was awarded the 9th Professor Ratnavelu Subramaniam Memorial Oration Award instituted by the Association of Physicians of India in August 2009. Dr. Mullasari, welcome to Famhealth and thank you so much for sparing time with us and being with us here today. Dr. Mullasari, let me first begin by asking you that in light of the recent pandemic, especially, a lot of conversations were happening related to comorbidities that were causing a little more stress on people when they got COVID. What is it that we know about the disease today, and what would you advise people to keep a general healthy heart going forward?
Thank you, Vaishali. And the COVID-19 was a new virus which the human body was not used to. So COVID-19 basically is a virus which enters through the respiratory tract, that is usually the nose or the throat, and attaches to a receptor on the lung or the throat, which is called as an ACE receptor. Once it attaches there, it moves into the intra part of the lung, and sometimes it enters into the bloodstream, and where it attaches to the same receptor on the vascular system or the vessel wall of the body. So the various vessels in the body onto which the COVID-19 virus attaches to creates what we call as an inflammation on the vessel wall. And when it inflames the vessel wall, it creates a pro-clotting process, and all the clots form in the various vessels on the body, which includes the vessels to the heart, to the brain. It could cause a clot in the leg veins. It could cause a clot in the lung arteries, creating pulmonary embolism. So typically, the patients would present with various clots in various parts of the body, which could present according to the vessel involved. So if you get it in the artery, into the heart, you get a heart attack. If you get it into the vessel, which is supplying the brain, it could create a stroke. If it attaches to the leg veins, it could cause what is called as deep vein thrombosis. And in the lungs, it causes a lung embolism and oxygen coming down. So this is how it does the COVID-19. The second part is of the immune reaction. So once the COVID-19 creates the infection and inflammation, the second part of it, which usually happens after the first week, is an immune reaction. The body reacts normally by killing the virus in most patients. But in some people, there's what we call as a hyperimmune response, which means that more than what is required, there's immunity created. And that creates the damage to the lungs or to the vessel wall or to the various body parts. So there are two parts. One is the active infection and two is the immune reaction. So comorbidities like, say, diabetes, hypertension, previous heart disease will create problems to the patient more than otherwise. So this is what we need to know, that diabetic or hypertensive patients will create, they will be at more risk than normal people to this virus.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर, और हमारी YouTube पेज माय फैम हेल्थ पर सब्सक्राइब करना ना भूलें।